This segment sponsored by GBMC Healthcare.
Okay, with now 2 possible cases of the coronavirus in the state of Maryland, we're sure that you, just like us, are wondering, how worried should we be, and what can we do to prevent ourselves and our family members from getting sick?
Well, here to offer some insight is our friend, Dr. Theodore Bailey. Welcome.
Thank you. Thank you for having me.
Thank you. Okay, coronavirus, hot topic. Tell us, what is it?
So what is the coronavirus? Well, coronaviruses are actually a family of viruses, and some of them are very mild. In fact, some of them cause what we call the common cold. But a number of them over time have actually caused serious and severe outbreaks and epidemics. And we have one right now that started in China and that's spreading worldwide.
So what are some of the symptoms of the coronaviruses?
Well, the symptoms of the coronavirus are a lot like other respiratory viruses. The 3 main symptoms are going to be fever, cough, and shortness of breath, but that sounds like lots of other infections as well.
Yes.
Right. So how do you know? Is it coronavirus or one of the viruses or the flu?
Well, fortunately, we do have tests available, and these are tests that are run through the CDC, and so we're able to test people who have both the right symptoms, but also the right travel history or exposure history.
Right.
So speaking of exposure, how are these viruses transmitted?
So they are respiratory viruses, and the main mechanism of transmission would be from one person's lungs to someone else. So by coughing or sneezing, droplets would come out that would contain the virus, and out to several feet, those could be inhaled or sort of land on the person. They can also land on surfaces, and if you were to touch a surface, not wash your hand, touch your face, that's another way in which you could acquire it.
So what's the best way to protect ourselves? Hand washing, obviously.
Very good. So I was going to lead with that, and not enough people do it. You can carry around your own alcohol wipe. You can use soap and water. So if you do that several times a day, certainly do it, after contacting stuff. You can also, clean down surfaces as well. That's important. You're seeing masks, I think,
yes,
in the news. Those can reduce the transmission, but none of these are perfect mechanisms.
Wow.
But using as many of them as possible will reduce your risk as much as you can.
And what about, we're all shopping online nowadays. What about packages that are coming to our house from China? Could they possibly be exposed?
Well, that's a good question, and as this is a new virus, one that we're learning about, we can't say that that's impossible. And in fact, when we look at viruses like this in the past, it's been a concern then as well, and they looked at how long viruses of this type might persist in the environment, and they did find that they could last up to several days, even several weeks, under the right environmental conditions. So with the new virus, it's certainly possible that it could be on a surface and persist for the time it would take to get across the country or get across the world.
Okay, so what is this outlook? What's the outlook now regarding the outbreak?
Well, I would say that the genie is out of the bottle. Over the last several weeks, we've seen an increasing number of cases occur. So not just the same amount of cases every week, but actually more and more cases, because each case can give rise to a new one. So we are seeing a spread. We're seeing it in over 20 countries, essentially worldwide at this point, and we're seeing more and more cases. And in the U.S. alone, at this point, up to February 5th, we've seen 11 cases, and we've seen 2 cases that are spread by someone who's come to the U.S. and then spread it to the next person. So I would expect more and more cases as we go forward.
So wipe down every surface you come in contact with, wash your hands. What about the flu shot?
So I think the flu shot's essential, and for 2 reasons in this context. One is that this is going to be a season where there's going to be a lot of uncertainty. Symptoms are very overlapping: cough, fever, shortness of breath. So people with the flu are going to be looked at very carefully. They may be quarantined, they may be isolated. There's going to be a lot of fear. So if you can do something to prevent having the flu or having a severe flu, you're going to be less likely to come into that whole setup. The other thing is that the flu actually is severe. We talk about, with the coronavirus so far, 24,000 cases and somewhere in the vicinity of 500 deaths.
Wow.
That's not good. But with the flu in the U.S. alone so far, we've already had roughly 180,000 hospitalizations and 8,000 deaths. So if there's something you can do to make yourself less at risk of a severe flu or even dying from the flu, it's worth doing, and the vaccine is the most powerful way to do that.
Right, so in talking about which one is the greater threat to the public, what would you say?
Somebody right now in the U.S. is more likely to die from the flu than from coronavirus. So I would do what you can to prevent that.
Okay.
Thank you so much. This information is so relevant and so important right now. So really appreciate you coming on and speaking with us.
Thank you.
That's right. Thank you, Dr. Bailey. Stay with us.